Bilateral development cooperation is a cornerstone of Iceland's international development work. Building on long-term partnerships, Iceland provides funding, technical assistance and capacity building to country partners with the overall goal of reducing poverty and hunger and improving livelihoods. Despite Malawi and Iceland being roughly the same in size, Malawi's population is almost 55 times that of Iceland. Malawi has a population of around 20 million people and is one of the most densely populated countries in Africa. Over 80% of the population live in rural areas and have very limited access to basic services including health, education and water and sanitation. Iceland has been working in close collaboration with the Mangochi District Council to deliver basic services since 2012, with a special emphasis on improving healthcare and in particular maternal and neonatal health, as well as improving community-based health services in rural communities. Despite making progress in the last decade in bringing down maternal mortality rates, which are deaths due to complications in pregnancy or childbirth, Malawi's maternal mortality rate is still one of the highest in the world, with 349 deaths per 100,000 live births. Long distances between patients in hospitals, poor referral systems, lack of equipment and drugs, the undertraining and understaffing of healthcare workers also play a large role. The high prevalence of teenage pregnancies is also a contributing factor. In cooperation with the Mangochi District Council, Iceland is supporting activities to alleviate the acute need for improved healthcare services. This support includes building healthcare facilities in hard-to-reach areas, capacity building and trainings for healthcare staff, strengthening referral systems, and supplying of medical products, drugs, and ambulances. Community health interventions are also a big part of prevention efforts, as is encouraging women to seek healthcare throughout their pregnancy. The impact of this work is clear. The maternal death rate in Mangochi declined by 50% between 2012 and 2021. This is because more pregnant women than ever are receiving appropriate antenatal care, delivering their babies at health centres, and being cared for by skilled healthcare providers at childbirth, be they nurse or nurse midwife. Iceland's overall investment in health systems in Mangochi to improve maternal, newborn and child health since 2012 is over $15 million. One of Iceland's biggest investments was the construction of a new maternity ward at the Mangochi District Hospital. The ward was opened in 2019 and has transformed the quality of care for expecting mothers and newborn babies.
Before that, we used to accommodate this unit within the Mangochi District Hospital, and the place was quite tiny. It wasn't spacious enough to accommodate all the women that needed admission in this unit. But once we opened this facility, we have enough room, though it's crowded because women coming to receive services or to seek services here are increasing in numbers. But compared to before January 2019, this has been an ease for us as a district.
And now, construction of a new additional operating theatre at the maternity ward is underway.
Our theatre, because of the capacity, wasn't enough to accommodate all the patients that needed surgeries. We could have maybe 5 patients awaiting surgeries at one point. And now there's a project with support from the government of Iceland to construct an additional theatre for the unit. And that will ease the workload that we have been seeing with our the current theatre for women needing surgeries.
In addition to the maternity ward, a new paediatric and child health department at Mangochi District Hospital opened in 2020, which gives comprehensive care to over 15,000 children under the age of 5 every year. Over 100 children a day are treated at the ward on health threats such as malaria, dehydration due to diarrhea, and pneumonia. In June 2022, Lilia's Fistula and One Stop Centre was handed over to Mangochi District Council with support from UNFPA and funding from Iceland. The centre will provide a safe space for survivors of obstetric fistula and gender-based violence. The centre is the first district-based facility in the whole of Malawi. The impact will go beyond district boundaries, as other surrounding districts will also benefit from the services offered at the centre.
As a region, we don't have a dedicated center. We are sending patients to Lilongwe, which is more than 300 kilometers away from the district, to have surgeries, to have fistula repairs. But with the coming of this Lily Fistula Center, we should be able to do surgeries within the district. Currently, we have more than 30 women who have been identified with vescovaginal fistula within the district awaiting surgeries, and we are hoping in the next 2 or 3 weeks our center will be operational and we'll be able to support these women.
9 maternity wards and guardian shelters have also been constructed at health centres in hard-to-reach areas in Mangochi District. The distance that 69,000 women of childbearing age have to travel to access maternal services has now been drastically reduced with the construction of 9 new rural maternities. And importantly, their access to skilled birth attendants has increased as they are now stationed nearer to their homes. Great progress has been made as infrastructure, working conditions and service delivery for mothers and young children has improved with the selfless work of district health workers and support from Iceland. Maternal mortality is down by 50%. The proportion of children under the age of 1 that are fully immunised is up 91% from 69% in 2012, and over 300,000 individuals now access health services at 21 rural health posts built in cooperation by district authorities in Iceland. Preventing maternal deaths is crucial, not only because of the lives that can be directly saved, but because mothers on average have 4 to 5 children. And by saving mothers, the outcomes for families and communities as a whole are greatly improved. Mangochi showcases the ground that can be gained in improving maternal and child health, although there is still a lot of work to be done both in Mangochi and Malawi at large. Now, after 30 years in Mangochi, Iceland is expanding the scope of its work and starting a new chapter in Malawi-Iceland relations. Building on lessons learned and positive results in Mangochi, Iceland will now work hand in hand with the District Council of Nkota Kota to replicate and deliver basic services to its population.